All attendees are in listen-only mode.
Hey everyone, I'm Susan Kaufman and you're listening to Attitude Magazine's ADHD Experts Audio. Our topic today is a big one. It's anxiety, and according to today's expert guest, Dr. Thomas Brown, anxiety is one of the conditions that most frequently occurs in conjunction with attention deficit disorder, and it's sometimes quite difficult to separate the symptoms of anxiety from the symptoms of ADHD. Dr. Brown will be talking about how do we identify the different types of anxiety disorders, how are those treated, why children with ADHD are much more likely to develop an anxiety disorder than their non-ADHD peers, and he's going to suggest some coping mechanisms for managing anxiety as well as tips for when you should be looking for professional help. As you may remember, if you've listened to a webinar previously with us, Dr. Brown is a assistant clinical professor of psychiatry at Yale University and an associate director of the Yale Clinic for Attention and Related Disorders. He is the author of a number of really helpful books, which I highly recommend to all of you, that explain with great clarity what attention deficit disorder is and the myths that surround him. One of his latest books, called New Understanding of ADHD, has a great discussion of the overlap of ADHD with anxiety and other disorders, and his most recent book, Smart But Stuck, has super readable case studies of young adults and college students. And in that book, he focuses on the role of emotions in ADHD, and it's pretty much been ignored until Dr. Brown pointed it out. So thank you so much, Dr. Brown, for being part of our webinar series again today, and welcome.
Thank you, Susan. I'm really glad to be here.
It's a pleasure to have you as always, and we are grateful. Just let me mention a few things before Dr. Brown takes you through his slides. Post your questions in the box on your screen. Dr. Brown will, after his introduction on anxiety, he'll answer as many questions as we have time for. If you have problems hearing us, it's almost certainly your internet connection that's the cause. So if you can, dial in via your phone line if it's really fuzzy. Dr. Brown's slides and the audio of his broadcast will be on the Attitude website, attitudemag.com/webinars. And shortly, usually within a week or two, we'll have a podcast up in the iTunes store in the ADHD Experts audio series. Please do check out that podcast on iTunes. There are a vast number of really wonderful audio podcasts available there. So with that, let me turn it over to Dr. Brown. And again, thank you for being here today.
Thank you. Let's go ahead and begin with the slides. What I'd like to do is first just begin to talk a little bit about how we're conceptually, what we're thinking about when we talk about anxiety, and then a little bit about how the various types of anxiety, and then how this relates to and overlaps with ADHD. So I'm having a little trouble seeing my slides right now. They were on and now have come off, so I hope everybody else can see them. But I'd like to begin by talking about the way in which anxiety and fear overlap. Many people use these terms interchangeably, but generally fear is something which is a little more specific, that there's a worry that there's some particular unpleasant or dangerous thing that's going to be happening, and that it may be a realistic fear, or it may be something that's not very realistic, but it sure feels realistic to the person who has the fear. And then anxiety is a more general term, but usually is used to talk about anxiety as sort of excessive worry that something unpleasant or dangerous is going to happen. And you can see how these definitions are similar enough that people often use the terms interchangeably. But the thing that on this slide that I'd like to emphasize is that these two types of problems, fear and anxiety, come in small, medium, and large. You know, there are some things, for example, that we need to be afraid of and should be afraid of. We worry sometimes about children who are kind of impulsive, and people will say often he or she seems to have no fear, and that's a scary thought. You know, we want our kids to be able to learn how to be afraid of things that you need to be afraid of. that you don't go to, tease an animal which is likely to come after you. You do not want to just walk out in the street without very carefully looking to see if there's anything coming from either side. So fear is not in itself a bad thing. The question is when the fear becomes so big or so inappropriate that the person is acting on the basis of fear in a way which is really interfering with their functioning. And there are a variety of ways in which this can happen, but let me talk about this in terms of some of the different types of anxiety disorders. The one at the top of this list is a phobia, and that's a fear that you may not notice unless it's challenged. For example, if someone has a dog phobia, you're not likely to see necessarily any indication that they're fearful unless all of a sudden you tell them that they're going to have to walk down the street past this dog that's in the front yard. A person who has a phobia of flying may have no fear and not look like an anxious person at all until their boss tells them that in order to keep their job they have to get on a plane and fly to Europe in order to transact some business deal, and at that point the person may feel as though they've just been sentenced to die. It can be a really scary business, but the phobia is something which, as long as you don't have to deal with whatever the problem is that you're phobic about, that doesn't really make much difficulty for you. However, once it's clear that you are going to have to encounter that, whatever it is that you're phobic about, that can get really scary. Now, it used to be that the second item on this slide was considered a separate type of phobia. They used to, what we now call social anxiety disorder, was in fact called social phobia, and it used to be that that would be taken to mean only somebody who got really nervous if they had to get up and give a public speech, or if a student who had to get up and give an oral report in front of the class. But we now know that there are some people who have a lot of social anxiety that's not limited to being in a spot where you have to get up and give a talk. For them, anytime they have to encounter people that are unfamiliar to them, they get really nervous. Sometimes you'll see this, for example, with a child who, long past the age when most of his or her peers are comfortable in going up to the window at the McDonald's or some other drive-in restaurant to order, insists that someone else do it for them. For some people, it's very scary to go into a cocktail party or a meeting of people where they're going to encounter people that they haven't met before. And they may appear to be very calm and collected and able to interact quite appropriately socially, as long as it's with people they already know and feel comfortable with. Occasionally you'll see this, for example, with some students who have been comfortable with a group of peers in high school and they enjoy being with these people and spend time with them, but then they have to go off to college and all of a sudden they're holed up in their room because they just feel terribly uncomfortable in dealing with other people that they haven't had a chance to get to know. Panic disorder has to do with a very abrupt sensation where one feels that one's life is in danger. It often comes out of a clear blue sky where you really don't have any clear indication of why it is. If you're afraid of snakes and somebody says, come on, we're going to go over and look at the snake, that's not surprising in the sense that you knew you're afraid of snakes. Panic disorder may occur in a situation where you've been there before and it's never been a problem, but now today it is. And what happens is it's usually an acute onset. It happens quickly, and the signs of it typically are that your heart starts beating much more rapidly than usual. Sometimes people say it feels like their heart's going to jump out of their chest. Other times, and along with that, you get sort of a cold, clammy feeling. You may have sort of a pins and needles sensation in your arms or your hands, and the person often just has the feeling that they get shortness of breath, and they get the feeling that they're having a heart attack. And in fact, sometimes people end up being taken into the emergency department of the hospital complaining that they're having a heart attack when in fact it turns out they're having a panic attack. Panic disorder seems to come out of the blue. Usually it doesn't last very long. Something around 10, 15, 20 minutes is about as long as it lasts. But the terribly difficult part of panic disorder is how much time you spend worrying about having it happen again. There's the panic attack itself, where you're afraid you're going to die right then and there, and maybe you better get an ambulance and get to the hospital. But that's usually over in 10 or 15 minutes. But then, having had that scary experience, often people begin to worry a lot about, is it going to happen again? Is it going to happen again? And very frequently, that fear gets attached to a particular place where the panic attack occurred. I've had a number of people, for example, in the community I work in, there's a part of the town where people have to cross the bridge to get into it and back home from the downtown area. And I've had several people who've had panic attacks on bridges, on that particular bridge. And the panic attack didn't seem to have anything to do with the bridge, but the fact is, since it occurred on the bridge, then they get scared about driving over the bridge again. Obsessive-compulsive disorder is quite different. In fact, there's some controversy about whether it really belongs in the list of anxiety disorders because it seems to have more to do with being able to put the lid on thoughts that keep intruding into your mind or feeling that you might do something. I remember one teenage boy I saw one time who lived in a very religious family, and they were used to going to church, certainly every Sunday and sometimes on other days during the week, and he never had a problem with it. But then suddenly he began to be hesitant about going to church, and then soon stopped, insisted that he was not going to go to church anymore, and it was a mystery to his family why all of a sudden he was not doing what the family had been doing for so long. And the fact is that when they brought him in and we talked about it, he said that he had one day, as the church service was going on, had the thought where he began to wonder what would happen if out of a clear blue sky I just stood up and said several loud swears so that everybody could hear it. And then he started thinking about how the clergy in the church would respond, how his parents would be embarrassed, and how other people would look at him. He was seen as a very much a well-behaved, straight-arrow kid, and he had very explicit swear terms that he was afraid he would say. And soon the thinking of what would happen if turned into, oh my God, I'm going to. And it turned out that his reason for avoiding going to church was very simple, that he couldn't get rid of that fear that he was going to stand up in the middle of a church service and speak in a way which would be considered very inappropriate by most everybody there, and embarrass himself and embarrass his family in a way that he couldn't face any of those people anymore. And so it was easier for him to just avoid going to church. For other people, obsessive means where you get stuck on a particular thought, where you can't get it out of your head that this or that is going to happen, that it would be unpleasant to have it happen. Compulsive is where you feel like you have to do something even though it doesn't make a lot of sense even to you. And this can be anything from having to arrange things in a particular way to having to count or recount things, or having to repeat behaviors like sit down, get up, sit down, get up, sit down, get up 3 times before you can do it, or having to reread things. There are a million varieties of OCD, but the problem and the thing that makes it appropriate to think of them as anxiety disorders is if you don't do for the compulsive behavior, if you do not do some of these routine things that you're required to do by that particular worry, then you feel more anxious. Once you perform that action, then it's not such a big problem unless it's something like the kid getting up and swearing in church. Most people are familiar with PTSD, post-traumatic stress disorder. It used to be known years ago as combat fatigue because it was used to describe soldiers who were coming back from military action where they'd seen friends blown apart and where their lives were in danger. But as we've learned more about it, it becomes very clear that this is something which can happen in a variety of ways in any situation where the person has strong reason to believe that their life is in danger. And so you'll see it not only in situations with people who are coming back from military combat in Iraq or Afghanistan or wherever, but also from people who've been in severe motor vehicle accidents, or for people who've been trapped in a building during a fire. And there are also varieties of this which fit when somebody has been in a relationship with somebody who threatens to hurt them. It might be a parent being too abusive to a child, or a spouse, who gets drunk and gets violent, or who's just got very little control over their own emotions, and tends then to threaten to lash out, getting right in the person's face and saying things that hurt a lot or cause them to attack the person in a long narrative that really makes them feel like they amount to nothing, and then particularly if there's a threat that this could hurt them physically and possibly kill them. Now, that's a long list of anxiety disorders. The one at the bottom, generalized anxiety disorder, is the person where you just say, oh, that person worries enormously about everything. And what goes with these incidents is that often the worry is something which takes up a lot of space in the person's thinking. Also, it can tend to make them feel jittery or edgy a lot of the time. It can preoccupy them with thoughts about what it is that they're worried about. It often will interfere with sleep, making it hard to get to sleep at night, or cause them to wake up in the middle of the night and have a difficult time getting back to sleep. There are a variety of ways in which these various types of anxiety hit, but it's intense, it's unpleasant, and it makes a person feel like things are really quite dangerous for them. But let's look now about another issue which I think is important here, and that has to do with the time course of anxiety disorders. Anybody who's raised children knows that there's some that are developmental, that there's a certain point that kids hit sometimes around 8 to 12 months where suddenly you get an intense stranger anxiety, and that little baby who was quite willing to be passed around to neighbors and friends and gooed over and coddled, now suddenly is terrified at having to separate from the caretakers that they're used to. And then they get a little older and you want to get the kid to get into the bathtub and take a bath, and suddenly you have a shrieking child afraid that they're going to go down the drain, even though anybody a few months older could understand easily that they're too big to fit down the drain. Similarly, some children are afraid to sit on a toilet because the noise of the toilet, and they're having little sense of how the shapes and sizes of things remain pretty stable, can cause them to fear that they would go down the toilet. Or sometimes when a kid's going to get a haircut, it's hard for them at first to distinguish between the damage which would be done if you're cutting their finger with the scissors and cutting their hair. Those are developmental types of anxiety disorders, and usually they can be dealt with pretty easily when it's a matter of you're sort of just having to explain to them that they're going to be okay, and you stay with the child and help them get some reassurance, and they experience whatever it is that they're particularly afraid of at that moment and see that it's not that big a deal. There are other more transient kinds of anxiety that occur in response to specific stresses and situations. Recently I had a family that came in with their son, who was a 12-year-old boy, and he'd suddenly had a lot of trouble sleeping, and didn't feel much like eating, and was worried a lot more than he normally would be. And I asked about things that had been happening, that he might have been worried about or that had changed during this time since that problem started. And it turned out finally that what he was worried about was that the grandfather of a good friend of his had suddenly died of a heart attack. And he was looking at his own grandfather, who was about the same age and looked a bit similar physically, and was fearing that somehow if his friend's grandfather could die all of a sudden when he looked like he was pretty healthy, maybe that same thing would happen to his own grandfather. The same thing can happen if you've got somebody in the family who is sick. A grandparent gets sick, and sometimes the child begins to worry a lot about not just grandparent, but also their own parent. It becomes a sort of an occasion for understanding that people do get sick and that people can die, and sometimes jumping to the conclusion that therefore it's going to be happening quickly to people that I'm really concerned about. Other more general concerns that you hear are kids who are afraid of thunderstorms, or kids who are afraid that the burglar will come and break into the house at night, or somebody will kidnap them and take them away. And there are enough things that appear on the news regularly in most communities that it'll stir that sort of thing up. Some of these are persistent fears. Some of them are recurrent, and some of them are very transient, and they come and then they go away. But now, I think it's important at this point then to think about, what about this with ADHD? When we're talking about people who have ADHD, one of the things that when you look at anxiety disorders, you can recognize is the likelihood of somebody having anxiety disorder giving them trouble if they have ADHD is considerably greater than if they don't. On this slide, it mentions that in the general population of children, about 5% of kids will at one time or another have one or another, or some, possibly several of these anxiety disorders I've mentioned. Among children with ADHD, the incidence of anxiety disorders is closer to 25 or 35%, depending on which study you look at. The comparable figures for adults would be 18% in the general population, and in the adult population of people with ADHD, between 38 and 63%, depending on which study you're looking at. Sometimes anxiety disorders are hidden, and what one sees is not the anxiety, but rather that this particular person, this child or this adult, gets extremely demanding in some situations, or much more stubborn than usual, or really oppositional, and sometimes aggressive. And it's important to keep in mind that sometimes children and adults who are being very aggressive and hostile and critical, underneath that, it may be that they're very frightened. And particularly if you're dealing with somebody who also has some of the autistic spectrum characteristics, it's very common for these kids to, and adults sometimes, to get very irritable when in fact the problem is they're being flooded with anxiety. So we've talked now about several different types of anxiety disorders. And what I'd like to do now is to take just a couple of minutes to talk about what kinds of things we can do that might be helpful when we're dealing with ourselves or with somebody else, our child or our friend or another family member who has a lot of difficulty related to anxiety. And then we'll get to some questions about it so we can be more specific. I think it's important, particularly if, when you've got a young child, to keep in mind that a certain amount of anxiety is pretty much par for the course with most kids. There's some children who don't look very anxious at all, but most kids, you're going to have some things where all of a sudden they're kind of nervous about something that maybe they weren't nervous about before. And there's no reason to assume that that has to mean that they're going to always be very anxious. They may just, at that particular point in their life, in their development, in their experience, they may need a little extra help to let them know that this is not as scary as it may look to them at that particular time. And of course, in those situations, it makes a big difference if the person who's trying to help reassure the child is himself or herself confident that it's nothing to be worried about. It really gets complicated when you have a family where you have, say, a very nervous mother or a very nervous father trying to reassure their son or daughter that there's nothing to worry about, when in fact the parent himself or herself is really acting as though they're barely containing their own anxiety. That certainly complicates the picture. And it's important, in dealing with children especially, to be able to be realistic about it. And you can say sometimes, I get nervous about these things too, but I have learned that that it works out okay, that it's not that scary as it may look. Or I remember when I was a kid, I used to be scared about this too, and then I found out it wasn't that big a deal. The tricky balance that parents have to work with, and also if you have another family member who might be a spouse or an older adolescent or other family member, to hit a reasonable balance between accommodating the anxiety and not accommodating it. Because the problem is that if you get too accommodating, if you work too hard at, okay, I will stay with you, I will sleep in bed with you each night, or no, I won't go out and leave you with a babysitter, I see that it's making you too nervous and I will stay home instead, you can end up with a child or some other family member who really, their anxiety turns them into a tyrant, who places too many demands on other people to go along with whatever it is they feel they need to deal with their anxiety. And the problem is, if you start doing that and do too much of it, you reinforce the fear, and that individual does not learn how to deal with the fear and survive it and see that whatever it is they're freaking out about may not be as scary as they think. On the other hand, there are some times when you just need to be able to be patient and hang in and provide some extra support. And I think it's very hard to be able to give a formula. It's not necessarily something where you say, well, this number of times you should give into it, and then that number of times you draw the line and say, no, you're just going to have to deal with this on your own. I'm going to leave you alone in your room even though you're so scared of the dark, and shut the door, and you're just going to get over it. Sometimes we do things, for example, if a child's afraid of the dark, of letting them sleep with a nightlight on, or giving them a flashlight so they can use it to see that what looks so scary may be just a couple of garments that are thrown over the back of a chair. Because we need to keep in mind when we're dealing with young children that their imaginations are very powerful, and that they can make out of anything that looks ambiguous something that's really scary. But getting that balance is a tricky thing that a lot of people struggle with when they've got a family member or a good friend who's very anxious. And then there's the question of when is treatment needed. Again, there's no hard and fast rule for this, but if anxiety is, for example, keeping a child from being able to go to school for more than just once in a while, a day or so, but where the kid is avoiding going to school, or where you have a grown-up who is refusing to go to the doctor to get medical treatment that they really need, or dental care that's needed to prevent them having some systemic infection. Those are situations where the anxiety is controlling too much, and the person may need some treatment to be able to help them get through it. And sometimes the person recognizes the need for the treatment, and they'll be more than happy to go get help. And in other cases, they want to deny that there's anything unusual. It's just that they're worried about something that they feel really needs the treatment. So let's look at this. This is just a short list of some of the interventions that may be useful. The one that parents generally rely on and that very often works is reassurance and support. Providing enough support of saying, I'll be with you, I'll help you get through this, and giving them, the child, enough explanation about what it is that's happening so they can have a better idea of what to expect. Sometimes people try and deal with this, with the child's fears, by not telling him anything. Oh yes, we're going to go to the doctors, but I'm not going to tell the kid about the doctor's appointment until just before they have to get in the car in order to go. And sometimes that's a way of trying to avoid having to listen to the kid whine, cry, and complain about it. But usually, you don't need to make the announcement about something like this days and days ahead, but it's usually a good idea to give a person a little bit of time to get used to the idea if it's something that you have good reason to believe that they're going to find scary. And then being sure that they know they've got some support. The other kinds of treatment that we use, cognitive behavioral treatment, it can be quite helpful for certain kinds of OCD and for phobic situations, things that people are scared of, where we can gradually expose them either in their imaginings or in fact to some of the things that they're frightened about and help them get a clearer idea of how the risk is not as big as it seems to them. Sometimes the therapy needs to be directed just at the individual who's having the problem, and sometimes you need a situation where the whole family needs to be involved because other members of the family need some strategies so that the fears of one member are not driving everybody else in the family nuts. Psychotherapy, where there's a more exploratory approach, is sometimes necessary just to get a clear idea of where the difficulties are. And with medication, you don't want to be too quick to jump into medication, but the fact is there are some anxieties that are so strong that are really disruptive of the person's sleep and daily functioning, where for a while they do need some medication. And we've got short-acting medication like the benzodiazepines, like Ativan and Xanax, for example, and clonazepam or Klonopin. Those have different durations of action and slightly different characteristics that can work for anywhere from about 3 or 4 hours to 8 or 10 hours. But the thing to know about that is sometimes they work too well, and they reduce anxiety so much that the person then becomes afraid to be without them, and they keep wanting to take more and more, and pretty soon you can have someone who becomes too dependent on the medicines, and they're actually psychologically addicted to them to the point where they can't live their life without popping pills every 3 hours. And in fact, the medicine at that point is not doing very much for them except to help them deal with their fear that they'll not be able to survive without it. Often SSRI medicines like Prozac, Paxil, Zoloft, Luvox, Lexapro are medicines that go in on the serotonin system, and people are less likely to be addicted to them, but they do help. They don't help as immediately. The short-acting benzodiazepines usually help quickly, and you want to use the minimal dose to be able to get things done so the person can go about their life, whereas the SSRIs, they can take 3 or 4 weeks before they kick in to do much of anything, but they can really help to reduce some of the obsessional worrying. And then once they do kick in, if for somebody who's worrying too much about a panic attack or some other obsessional worry, then you can use the benzos just as a fire extinguisher to give the time when the person's particularly anxious. So those are just some basic facts about anxiety, and what I'd like to do now is focus on some of the questions that people have already submitted. So I will be happy to respond to questions.
Thank you so much. Okay. We have, thanks for that great introduction overview about anxiety. It's interesting. There are so many forms of it. There are lots of questions here. Let me just start with a question about diagnosis. Mm-hmm. People are wondering how to figure out when the symptoms are ADHD related, when they're anxiety related, and which one should be treated first. How does one approach that?
The general principle when you're looking at somebody with a range of problems is to ask the question, what's making the most trouble right now? And in the case of somebody who's very anxious and has ADHD, sometimes the anxiety is a result of their worrying that they're going to embarrass themselves or that they are just going to be totally unsuccessful in whatever it is they have to be doing. And then in that case, if you can get the ADHD under control, which often, not always, but often we can do quickly with certain types of medication, then they're not so worried about themselves if it's a performance anxiety thing. At other times, you may have somebody who's very frightened because there's somebody in the neighborhood or somebody in the family who's very sick, or maybe there have been some burglaries or shootings in the neighborhood. There's some people who live in neighborhoods where you have to worry about that a lot. Or there's some other crisis that's going on, like the family is moving and relocating to a different town or a different neighborhood, or there's somebody, the parents are separating and divorcing, and suddenly the kid isn't able to sleep at night. And in a situation like that where it's interfering with sleep and or appetite and being able to go about the daily routine of life as expected for that individual, then I would be more inclined to treat the anxiety first. And then if ADHD is still giving them a lot of difficulty, then I would move in. If they're already being treated for ADHD, which is often the case, then I'd leave the ADHD treatment in place and add some sort of intervention according to what's needed for the anxiety. However, it's also important to know one other thing, and that is there are some people who have ADHD and anxiety where the stimulant medicines that we usually use as our first line for treating ADHD make the anxiety worse. That's not always true. I've had some people who've been started on stimulants and who have tried a bunch of medicines for ADHD previously, and then we'll say, you know, this, a bunch of medicines for anxiety previously, and they'll come back saying, I feel more relaxed than I've ever been before. However, it's also true that with stimulants, sometimes the person feels like they're going to jump out of their skin, even on a very low dose. And so if you run into heightened anxiety when using stimulant medication to treat ADHD, usually you have to back off of the stimulant medication and deal with the ADHD and then possibly come back with a non-stimulant medication in order to be able to address the ADHD. So part of it's a matter of what intervention will work, and part of it's a matter of what's making the most trouble for them.
Okay, but in theory, it's okay to treat both simultaneously.
It certainly is, and often we do that. You know, I've got many patients who are taking medication for ADHD and at the same time are taking medication for panic disorder or for obsessional ruminations or trying to deal with some PTSD things related to life experiences they've had. And those medicines do not necessarily conflict with one another, but you don't want to be prescribing two things at the same time at startup because then you can't tell what's causing one.
Hello? Yeah, I'm not hearing Dr. Brown. Can you hear? Oh,
I can hear you.
Okay, great. I can hear you now. Somehow you went away. Some specific symptoms. There are, interestingly, probably 7 or 8 people on the webinar who have posted about a specific symptom that their children are experiencing. That is chewing their fingers and nails and even the skin, you know, to a serious
they'll be nibbling at the cuticle.
Right, and even beyond that, you know. So
and then sometimes they'll, I'm thinking of a kid I saw yesterday who was chewing on his sweatshirt around the neck and the collar as he was doing. Often kids who get anxious will nibble on their fingers or be biting fingernails and so forth. Sometimes you also will see picking at skin, where they'll find a little area where maybe there's a little tiny scab or something, or a little pustule, and they'll keep picking at it and poking at it. And obviously adolescents often will struggle with acne, and they'll come out of the bathroom with their face all bright red because they've been poking so much. And sometimes that's a matter of their being self-conscious and hoping that they're going to be able to get over the zits that they're dealing with by just squeezing all of them, which does not always help. And other times it's just a manifestation of a generalized nervousness. The one thing that can help is when you've got a kid who's nibbling on his cuticles, is to be sure to keep that skin soft and use some sort of a moisturizing lotion and rub it in carefully a couple times a day so that the skin doesn't dry out, because otherwise what happens is the skin gets dry and then it becomes a matter of trimming the hedge. where you nibble on this side, then you've got to get it even on the other side and so forth, particularly if they're a little on the OCD side.
All right. Similarly, there's a question about from a parent whose daughters pull their eyelashes and even their hair out as a way of dealing with anxiety.
That's a very particular kind of anxiety symptom. It's called trichotillomania. And it's often a matter, sometimes you'll see a person, a child or adult, who will sort of run their fingers in their hair and then pull out a hair or two at a time. And sometimes it's a small problem and there's not much hair being pulled out. They may just pull at it. And other times you can get it so that they actually become bald in certain sections of their head. And that's something where if it's happening very much, it's probably a good idea to get a consultation with somebody who knows about how to treat it, because there's some specific medicines that seem to help with that and a lot of other medicines that don't.
Right. So are those forms of anxiety disorders ones that are treated with cognitive behavior therapy?
Sometimes cognitive behavior therapy will work, and sometimes you need medication, and sometimes you need both.
Okay. Lori wants to offer a link to tlc.org, which is for trichotillomania, so offer that as a resource to those of you who are dealing with that, and I can second that recommendation.
Mm-hmm.
Can we talk a bit about social anxiety? Again, if I'm looking at, the 900 people posting questions here, there are a significant number of people who either themselves, their spouse, or their child is dealing with very serious social anxiety, real impediment to a college-age student leaving the dorm, meeting new people, in an adult making friends, going out, and in children, play dates, whatever. It seems to be a pretty major form of anxiety that is raising its head here.
That's right. And social anxiety, in fact, is the type of anxiety which is most commonly reported by adults with ADHD. If you look at the subclassifications, that's the one that you're likely to see most frequently. And I think the first thing it's important to keep in mind is that people vary, even people who do not have ADD, vary in terms of how comfortable they are in social interaction. Sometimes we want for our family members and our children particularly to be comfortable in hanging out with other people their age, and to be able to be comfortable in meeting older people and younger people and so forth. And that doesn't come easily to some people. The clearest example, of course, of the more extreme form would be those who are on the on the autistic spectrum, where they really need some time by themselves and tend to get very fearful when they're forced to deal with people they're not familiar with. So I think part of it has to do with a level of expectation. Not everybody is equally comfortable with social interaction. However, it's also true that there are many people who feel anxious about social interaction with new people that they're not familiar with, who can learn gradually to be able to tolerate it and eventually to enjoy it. Typically, they'll venture out to do a little bit with this person or that person, but a lot of it is caught up in the anticipation of how a person is going to, how other people are going to see me. When you talk with someone with social anxiety, very often it's, I'm afraid to raise my hand in class because I'm afraid everybody's going to think I'm stupid. Or I'm in this dormitory room and I hear the other kids walking down the hall to head out to dinner, and I don't want to look like a loser by coming and saying, hey, can I go with you? And so I go and sit and eat by myself later. Or I'll just go into the dining room, eat as quickly as possible, and then get out of there. Or people who are very hesitant about accepting the invitation to a party. And it helps often if a person who has that difficulty can talk with somebody who's understanding about it and who has some appreciation for how frightening it can be to think that, you know, whatever you have to say is going to be looked at by other people as evidence of your being stupid or klutzy or totally uncool. Because often people feel so isolated with this. And sometimes they're able to find some friends who will do it. Junior high, particularly for girls, and the first couple of years of high school can be very difficult for kids because the peer group interaction gets really quite vicious sometimes. And so you can feel like you're just sort of totally extruded from the group of people that anybody else respects, and then you end up feeling like you're sort of in the losers club, and maybe you can find one person who will sit at your lunch table with you to be able to have a meal. So part of what's involved in a situation like that then is to talk with the person, listen to the person, hear a little bit about how difficult some of these things are, and then if you can, to try to help them to be able to practice some of the things and think about very specific ways that you can reach out. Sometimes it's as simple as somebody who's afraid to answer the phone, or afraid to pick up the phone to call to get some information about something, or to go up to the popcorn counter at the theater and buy a box of popcorn. And if you have a child who's a little bit more on the anxious side, helping them to learn how to master those fears a little bit at a time can be a big help. And while at the same time appreciating that it takes a lot of courage for them to take those steps. If the social anxiety is something which is a big problem, then that may require something where you've got a little more professional help involved in terms of social anxiety, in terms of how do you introduce yourself to a new group. I've seen a number of kids getting ready to go to college who really need some help in addressing that sort of thing, because sometimes that can be the social adjustment can be a bigger problem when you're moving away from home for the first time than dealing with the academic pressures of the school.
Absolutely. Yeah, I think that's what we hear at Attitude. You know, the kids who, ADHD kids who really have a problem in college, it's oftentimes not the academic work, it's everything around it.
Yes.
You know, the schedule, social life, sleep, eat.
Yeah, sometimes it's organizational and stuff, but a lot of the time
Right.
there's just an enormous amount of anxiety that
Right.
many times these kids who complain about their parents and how talk about how much they're looking forward to getting out of the house and being on their own, once they get there, begin to feel like it's a much scarier world out there.
Yep. What about test anxiety? That's another one that's come up here in the questions that are posted. Some serious test anxiety, almost difficulty even, you know, going to school on the day of tests, or really a very specific. I guess it's kind of a performance anxiety. Then would it be?
It's a variety of performance anxiety, sure, but there are a number of things to look at. One of the first questions that parents need to ask themselves in dealing with a son or daughter who's got a lot of test anxiety is, have they done everything they reasonably can to help the kid put the test in perspective? There are some parents who are so anxious to see their kids to be successful and get really good grades that they make it seem to the child as though if they get a lousy grade on a test, that it's a terrible thing. And while on the one hand you want to say, you know, be sure to study for the social studies test, you know, it's important to do a good job on it, but on the other hand, it's also important to say, but this is not a matter of life or death. All right, so you got a lousy grade on this test, let's study some more for the next one. You know, that it's important to keep some perspective about how big a deal this thing really is, because there are some parents who make it seem as though every single test is what's going to determine the child's fate for the rest of his or her life. And that's simply not true. Another thing is to encourage them to learn how to prepare best for the test. And if a child is not adequately prepared and they're a little anxious anyhow, that's going to be a problem. And so there may be a place for the parent to talk with the teacher and get some sense of what kinds of problems the kid is having in the way that he or she is answering the questions on the test, and get some help in strategizing and helping the child to learn some strategies to be able to make better use of the study time. But then there's some situations where, both of the things I just mentioned have been taken care of well, and the person is just terrified of it, and then that becomes a matter of needing to get a clearer sense of what it is that this individual feels is at stake. Well, there are some tests that matter more than others, but there are also a variety of ways of living a life and getting an education that don't necessarily require passing every single test. So if it's really problematic, then it's probably a good idea to consult somebody who's good at talking with the children or adults about anxiety and trying to figure out what strategies might work better. And frankly, there are some people that I've dealt with for anxiety problems in terms of tests where we've had to work out something where we could give them a small dose of a short-acting benzodiazepine just to be able to take the edge off the anxiety so that they could go in, because often it's anticipatory anxiety. It's the fear of getting ready to walk in the room and take the test. And that once they actually get engaged in the test itself, they may be able to just get focused on that and it works out all right. There are other people who will say, oh my God, oh my God, oh my God, there's no way I'm going to be able to do this. Look at this, I don't know this, therefore I'm not going to be able to answer any of it.
Right. So Lori mentions that her child has almost OCD-like symptoms that seem to arise out of anxiety. So he becomes so paralyzed by fear that he starts counting to fours or multiplying by fours in his head. She's wondering about the relationship between OCD and anxiety and ADD and how those fit together.
Well, I think that's probably a matter of somebody who's got an inclination toward OCD, which incidentally is quite heritable.
Interesting.
And that, as are anxiety disorders, these things run in families the same way ADHD does. And you can have one parent who's passing the kid on the genes for anxiety, and another parent who's contributing a little more in the way of genetic loading toward ADHD. So they're sometimes getting it from both sides. But that's the thing about OCD is it gets better and it gets worse. And it's often reactive to situations. So if a person who has OCD is put in a situation where suddenly things are getting kind of ambiguous, or there's some things about what's happening that they just don't feel prepared to deal with, what happens often then is you'll see their anxiety escalate, and with it their OCD symptoms. And so then they may be reading and rereading the same sentence half a dozen times. Or they, just like you see some people, they get nervous, and they'll twitch their feet, or they'll be tapping their fingers on the desk. And some people, they get nervous, they get anxiety. It's manifest in more behavioral, bodily things, where some people, when they get anxious, they get headaches, and other people, they get shortness of breath. Other times they get asthma. Other people, they get diarrhea. I can tell you, we had one of the famous professors at Yale years ago who was recognized as one of the outstanding lecturers on the entire faculty. Very few people knew it, but in spite of the fact that he'd been teaching for many years, every time he was getting up to give a lecture for his course, which he had to meet 2 or 3 times a week, he would go and vomit first.
Oh.
That was just the way his anxiety before doing it, even though he came across as a very smooth performing, very articulate guy, and certainly knew his subject area. That was an anxiety problem that he had had for years.
That's interesting, and yet still high functioning. Which leads me to another question here. In your book, Smart but Stuck, which is extremely interesting, I thought, because of the case study format of it, you addressed people, or young adults, for the most part, college students, high school students, young adults, who are very bright. And there's a question here, and we frequently get this question, what about, are there specific issues in anxiety or ADHD with those children or young adults who are quite bright?
Well, one of the specific issues is that often the expectations they have for themselves and the expectations that other people have of them, oh, you're so smart, become a burden. because they then begin to feel like everything they do, they ought to be able to do with enormous success.
Right, that makes sense, yeah.
Some of the work that Carol Dweck has published in her book Mindset and some of the other articles have addressed the difference between teaching a child to, that he or she is very smart has a very vulnerable quality to it, because then when they encounter something that they are not able to manage right away, they tend sometimes to freak out and think, oh my God, people have been telling me I'm smart, but I'm not really that smart because, see, I can't do this. This is calculus. I can't do this. Or I can't write this kind of an essay that people are expecting me to write. There's no way I can do this, because they get the picture that their intelligence is sort of a given quantity and is quite high, but then you're going to hit a certain point where if you don't have it, you don't have it, and you're out of the game. And the work that Dweck and others have done is to say, hey, look, it's not so helpful just to say to your kid, you are so smart, but to say, you are doing so well, you are working so hard, with the expectation that regardless of how smart they are, it's not enough to be smart. It's also something where one needs to be persistent and consistent in working. Because the fact is there are a lot of smart people who just don't put out enough in the way of effort to be able to move from, I don't know how to do this right now, to, yeah, I get it.
Mm-hmm. Right, that makes sense. So, yeah, on the one hand, the understanding of the situation may be higher, but the ability to cope with it and the expectations would be really serious.
Right, and the other thing, let me just add one more thing to that, and that is to say that one of the things, this is something my father used to say to me, the more you learn, the more you realize how little you know.
Right.
And I think that getting that kind of message across, sometimes parents who are particularly successful and bright themselves have a way of trying to encourage their kids by talking about their accomplishments. Mm-hmm. And what they can do that's going to be much more helpful usually is talk about their failures. The times they didn't know what to do, the times they messed up on a test, the time they had a difficult time with this or that course. Right. Because our kids, in spite of the way they cut us down sometimes, tend to have this idealized picture of how much we're on top of our game. Mm-hmm. And they need to understand, regardless of how much you're on top of your game for some aspects of your life, it hasn't always been that way, and it isn't that way all the time, even today.
Right, yeah, that's a really good point. Which it links to another question here from Jen, who says, is anxiety a sign of low self-esteem, or do those two have nothing to do with one another, low self-esteem and anxiety?
Well, somebody who's very anxious lives with a chronic feeling of vulnerability. Mm-hmm. And so in that sense, their self-esteem is low because they know they get really scared very quickly, and that has an immobilizing effect. Mm-hmm. But that doesn't mean that they can't also be very proud of the fact that they're very good at gymnastics, or that they, in spite of their nervousness, they have very high grades, or that they happen to be one of the best cooks in the neighborhood, or the self-esteem. I think when we talk about it as though it's all one thing, overlooks the fact that none of us is good at everything, mm-hmm. and that there are some things we can be proud of, and some other things where it's okay, but it's not wonderful, and some other things where we say, well, I'm a real klutz at that. I just can't do it very well.
Mm-hmm. I guess a final question is from Bernice, and she asked if you could amplify. You made an interesting comment about parents finding the balance between support and over-accommodation. And she says, they're having a really hard time doing that. They feel that children and the family life are hostage to one of their children's anxiety, despite, trying professional help. And they're just looking for any guidance on that golden balance between.
Yeah, well, I don't know that there's any.
Right. Can anyone hear me? Please write on your screen if you can hear me. I can't hear. Oh, you can hear me. Okay. Well, we've lost Dr. Brown, and it is the end of the hour. So we will close and thank Dr. Brown for a really interesting session. Please look for it on iTunes and submit your questions, and we'll have a follow-up because I think this topic is so big and so important that we really should follow it. Thank you so much, everyone, for participating today.